Well, it's more prevalent than what we think, that patients with COPD and also asthma, actually, if you look at multiple papers published and surveys, and actually we've done some work as well, that at least when you look at metered dose inhaler, this is the most commonly used device. Most patients in one of our recent publications has done at least one error in using the device correctly, critical error, and there are several critical errors that can be done. You know, with an metered dose inhaler, you have to time the inhalation or start of the inhalation and actuation. This is particularly the major critical error. Another one is the maintaining deep breath so that the drug goes down in the lung. Similarly with DPI, some patients don't take a good inspiratory effort, and if they don't, the powder is not dispersed, and it's not going to be so prevalence, like how often, around 60 to 70%, at least what's quoted out there, of patients with asthma or COPD misuse or not use the inhaler correctly. So it's pretty common. Unfortunately, when it comes to delivery system, we did some work recently where we surveyed clinicians and also patients with COPD. And I was shocked that neither groups, including pulmonologists, put the device as like one of their priority when it comes to medication or treatment of their disease. So they emphasized, of course, effectiveness of the medication is the most important. That's important. But if the drug doesn't go where it's supposed to be, it's not going to work. So there is lots of need for education of both our patients, but also our colleagues, that delivery system is important and actually should be one of the priorities when considering treatment, no matter whether it's a bronchodilator or anti-inflammatory that is being prescribed. Well, I mean, there are several factors that affect adherence to medications, full stop, whether it's asthma or COPD. Certainly, the use of inhaler device may be one of them. And the reason is if patients misuse their inhaler device, they don't get effective therapy, and therefore they won't feel better. So they may stop taking the medication. So it's like a vicious cycle. And so obviously, poor adherence in both asthma and COPD is one of the most common reasons why patients don't get better. It's not because the disease is severe necessarily. Some of them do. So I think one has to keep that link in mind. And so adherence obviously can be affected by misconception of the drug that they've been used, fear of side effects, cost. All these may affect adherence to therapy. Certain cultural thoughts, in different groups of people don't want to get an inhaler because they don't want to be addicted to it. So some of these things we see depending on the background of the patients we see. So there are several things that may interfere with adherence. The other thing that can interfere with adherence, particularly in asthma, is the fact that it's an intermittent, most of the time it's sort of episodic disease. So patients feel better, they don't think they need their inhaler, they control medicine, they stop it. And then they get worse again. So that's another reason why patients may not use it. But certainly poor technique in using the device may affect adherence.